am doing my second med administration video. I have Mr. Jacob Leonard here. He is a 60-year-old African-American male. He's being admitted to the hospital for a hypertension and a headache. He has a pain rate of 8. It looks like he's been without his blood pressure medications for the past 3 days. Upon admission, his blood pressure was 172/94. His pulse was 90. His past medical history shows that he has hypertension, chronic low back pain, and he has recently undergone chemotherapy for prostate cancer. He is a smoker. I would first start by verifying my doctor's orders, and then I would compare the MAR. And when I do that, I'm also doing a medication reconciliation. I am looking for any omissions, any duplications, duplications, and any interactions. So it looks like the patient's home meds are hydrochlorothiazide and lisinopril, and the doctor has ordered hydrochlorothiazide 25 milligrams by mouth twice a day, lisinopril 20 milligrams by mouth twice a day. I have heparin 5,000 units sub-Q, hydromorphone 2 milligrams IM, and a TB test. I would do my 3 med checks, and they're going to be when I'm pulling the meds, when I am outside of my patient's door and my bedside. I also want to do my 6 medication rights, which is right dose, right patient, right time, right route, right dose, patient, time, route, drug, and documentation. Once that is all done, I'm going to start with my first med check. So when I'm pulling the meds, I am comparing them to the MAR. It looks like we have what's ordered is hydrochlorothiazide 25 milligram tablet by mouth. What I have available is hydrochlorothiazide 25 milligram tablet. Expiration date is 6/23/2020. So that is correct. I then have my lisinopril 20 milligrams by mouth twice a day, and available I have lisinopril 20 milligrams by mouth. Expiration date is 5/26/20. Looks like I have heparin 5,000 units sub-Q available. I have heparin 5,000 units per milliliter, so I'm going to administer 1 milliliter sub-Q. Expiration date is 8/12/2020. My next medication is hydromorphone 2 milligrams intramuscular. It looks like I have available hydromorphone 2 milligrams per 1 milliliter intramuscular, which I administer 1 milliliter. Expiration date is 5/26/20. My next is going to be the TB test. I have a 5 TU per 0.1 milliliter. Expiration date is going to be 6/23/2020, so it looks like I am going to give 0.1 milliliters. I have then pulled my medication, so I'm going to start by preparing them. I would do that outside my patient's door. This is going to be my sharps container, and this is going to be my cup. So I would then don gloves and perform hand hygiene prior to entering my patient's room and when I am preparing the drugs. So again, I'm going to do my my second check, and get everything I need, all my supplies, gather them. So the first med I have is my hydrochlorothiazide 25 milligrams by mouth. What I have available is 25 milligram tab. It expires 6/23/20, and it looks like that's what the doctor ordered. I would place that in a cup. My patient would take that by mouth, and I would check them after they swallowed it, just to make sure they're not holding it in their cheeks. I then have lisinopril 20 milligrams tablet is ordered twice a day, and what I have available is a 20 milligram tab of lisinopril. Expiration date is 5/26/2020. My patient would take that by mouth. I would check their mouth again once they have swallowed, just to make sure nothing's being held in the mouth. I then have heparin 5,000 units sub-Q. It is not a multi-use vial, so I would let me check it. the heparin available is 5,000 units per milliliter sub-Q. Expiration date is 12/20/20. I would need a 22 gauge needle for the heparin. I would clean it off, pull it away, stick. It looks like my numbers on this side of the thing have gone away a little bit, but that is where it's at. I would then scoop method, and I would tape that, and there's going to be my heparin. I have my hydromorphone. I would break the ampulla with a alcohol swab, and I'm going to break it away from me. It's actually already broken. I would then get a 3 milliliter syringe. I would start with a filtered needle. I'm going to open it without touching the needle, and then here I would draw up 1 ml. Using the scoop method. I would dispose of that in the sharps, and then I would then get a 22 gauge needle, once again keeping it sterile. Dispose of this in the sharps. When I'm giving IM, the sites for intramuscular are going to be my vastus lateralis and ventral gluteal. I'm looking for the greater trochanter and the iliac crest. When I find the markers, I'll place my hand there, and then I'm going to go in at a dart motion, 90-degree angle. I want to aspirate just because it is intramuscular, and I want to make sure I'm not in any blood vessels. So those are the two places that I can administer IM, or I could do the deltoid, but since it is such a big needle, I would not do the deltoid on my patient right now. I'm then moving on to my TB test. I would verify it. I have a TB test, 5 TU per 0.1 milliliters. 6/23/20 is the expiration date, and it looks like it matches the MAR. I would then get a 22 gauge needle. I would clean it. I'll then use the scoop method. Here is my TB. My TB is a multi-use file. It is going to be intradermal. I could do it on the forearms, the clavicle area, or between the scapulas. So I have prepared all my meds. I am going to knock before entering my patient's room. I would identify my patient with 2 identifiers, first and last name, date of birth, and I want to check allergies prior to administering medications. I would then start with the hydrochlorothiazide. When I give this to my patient, I want to check the vitals before giving it to them. I would not give it to them depending on blood pressure. Explain to them that hydrochlorothiazide is just going to help with hypertension. Watch I's and O's. They will urinate a lot. I need to monitor electrolytes. After giving them this medication, they'll take it by mouth. Once my patient, I'll give it to them in a cup. Once they take it, I will then check their cheeks. Hold on, my camera keeps moving. I'll then move to the lisinopril, 20 milligrams. I have lisinopril 20 milligrams. Expiration date is 5/26/20. When I give this to my patient, I want to explain to them again, it's for their hypertension. To not get up without help. Rise in stages when they do, set the call light for them. Let them know that I need to watch I's and O's, check their vitals before giving it to them. Make sure they're okay with, if they have any questions, I would then put it in a cup and let them take it. Once again, I would check their cheeks to make sure that everything is swallowed. I then have my heparin. That is sub-Q, so I'm going to give that in the abdomen. I would give it away 2 inches away from any tattoos, any scars, or stretch marks. I'm going to give my heparin at a 45-degree angle. Oh, I'm not doing this right. There's no need to aspirate. I do not massage the heparin. I would then discard into the sharps. Explain to my patient that they're getting heparin, or prior to administering it, I would explain to them that they're getting heparin for to prevent any blood clots, since he is a smoker, and he is going to be laying down for a long period of time. It helps prevent any DVTs. I want to check their blood pressure and before giving it to them. That is it for the heparin. I have the hydromorphone. I would then have my patient lay on their side so I can find my greater trochanter in the iliac crest. I'm going to find them. Once I find them, I will pull the skin apart. I'm going to go in at a 90-degree angle. I would then aspirate. Once I aspirate and there's no blood, I would then go ahead and administer the medication. Once it's administered, I can massage it. And the hydromorphone is for my patient's pain. I want to assess the pain level prior to giving it and the pain type prior to giving it. I would come back in respirations. If respirations were under 10 to 12, I would hold the medication, and then I would come back in about an hour to check my patient's pain level and to make sure it is effective. I then have the TB test, which is intradermal. I can give it in the forearms, anywhere away from a tattoo. So I would then clean the area. I want to pull the skin apart. I would then go in at a 10 to 15-degree angle. I want to make sure that there's a little bubble. Once I do that, I'm okay to administer the med. I would then discard in the sharps container. My patient is getting a TB test because he's undergoing chemotherapy, so he is immunocompromised, and he does work at a homeless shelter, so we don't know what he's been exposed to. I would explain to him that he has 48 to 72 hours to come back to get the test read, or he will have to get it again, and just explain to him not to touch it or to rub it. Once I do that, I want to lower my patient's bed, make sure I have all the right documentation, and lower my patient's bed, make sure I have all the right documentation, set the call lights, set the bed alarm because my patient is taking hydromorphone, which is a CNS depressant, and I don't want them to get out of bed without any help. Set the call light, bed alarm. I would make sure the bed rails are up, the bed is locked, perform all the right documentation. I would then come back and check on my patient, check their vitals for the hydrochlorothiazide and the lisinopril. I would check their respirations for the hydromorphine, and depending on how long my patient stayed in the hospital, I would either check the TB tests the next few days, or I would refer them to their primary doctor to get it checked, and if it wasn't checked, explain to them that again that needed to be the test would need to be redone. And I think that is everything.